In tonight's health alert, nearly 19 million Americans suffer from diabetes, which has no cure. Those living with the disease often experience foot pain. CBS 19's Jamie Garrick explains why you shouldn't ignore these sensations after going to a medical seminar today.
Jillian, this free forum at ETMC mainly wanted to get the word out to diabetics that an infection or ulcer has the potential to create lots of problems for you, even become deadly. One of the nearly 50 people there told us why he's listening to the advice.
Well, I was diagnosed with diabetes about 10 years ago. I don't have feeling in the bottom of my feet.
That numbness Jerry Smith is experiencing led him to change a few things.
Eating habits, lose weight, take pills, stuff like that.
As a diabetic, he's also learned to protect his feet.
Very careful about can't go barefoot, you can't wear sandals, and you have to wear loose-fitting socks at the top for your ankles swell.
The problem with those like Smith is that sometimes problems fly under the radar.
They're not able to feel pain like most people would, but diabetics do tend to ignore their feet.
Burning pain in your feet could mean damage to your nerves, and ulcers lead to bigger problems if left untreated.
So sometimes the infection can go to their bloodstream and they'll get, poison from it.
Dr. Karen Weiss's message: to avoid the worst case scenario, an amputation by exercising, losing weight, and eating right.
Starches are probably the worst group overall for diabetics, but of course processed sugars are very bad. Portion control is very important, and then they need to certainly eat more fruits and vegetables.
The consequences are real.
Well, I know a couple of people that had their foot amputated, but
that turns into a serious matter when you consider treating diabetes costs the healthcare system $200 billion every year. Dr. Weiss also recommends diabetics not cross their legs, stay in cold environments, and purchase special footwear that will offset pressure points on the foot. Jillian, back to you.
Critical points must be taken care of. Thanks so much, Jamie. Now, genetics is a huge component in having diabetes. It's more common to see the disease in minority groups like Native Americans.
Fortunately, we know a lot about it and a lot of ways to manage.
We do.
So there are no consequences.
And there's been a lot of progress in the years made in treating diabetes.